Hello and welcome, I'm Tafara Gadamu. My guest today, Dr. Melkamu Meaza, a surgeon at Zawditu Hospital here in Addis Ababa, has come up with an engaging book on medical law and ethics. Are expectations in the business of medicine met in this country, and what are the key challenges? A very warm welcome to the program.
Thank you very much for inviting me.
Your book, when was it released, published? About a month ago?
Yeah, about a month ago, yeah.
And it is about, it is literally translated, it's in Amharic and literally translated into English as what? Medical law and ethics, right?
Exactly.
So you talk about international standards in your book, and you also tap into your experience as a surgeon in this country. So that's a very interesting combination, to say the least. Now, I want to talk. It's very difficult to talk about all the topics that you've raised in your book, but I'd like to pick a few of those topics that I think are much more relevant to our discussion of the medical profession in this country. You have been a surgeon for a while now, right?
Yeah.
You're not saying that you actually have made a mistake, right? Have you?
Yeah, as a human being, we all made mistakes. We all make mistakes, and but it's not about doing mistakes or not, but it's about admitting that we are human beings and we make mistakes in our lifetime, and we admit that there is a mistake, and then to deal with those mistakes so that we learn from our past to improve our future, and it will be false if I say that I've never made a mistake.
Yeah, ideally that's the case, but in reality that it is not, because it's rarely that doctors admit that they have actually made a mistake. In some cases, very fatal.
Yeah, there are mistakes. We are doing our job not to do mistakes. We are treating patients just to improve their health conditions and to heal them. But in the meantime, there are mistakes which can be which can happen, during the process, and which could lead to patient disability or death. But the intention is not to do harm, but sometimes, unintentionally, mistakes could occur, and but we have to admit that as a human being, we can do mistakes too.
I know, but what is the tendency like when in the medical profession in this country? I guess one of the reasons that you've decided to sit down and write this book is because there are folks in the profession that refuse to admit that they actually erred, they've actually made mistakes, in some cases very detrimental to the life of the patient. Yeah. Is that?
Yeah, whenever the best solution for to solve a problem is to call that problem by its name. So there is a problem. As a human being, we all do mistakes, and if mistake is a problem, then we have to call it by name. And if you refuse to admit that there is no mistake, that means that's the biggest mistake. The biggest mistake is to refuse to admit that there is a mistake. Otherwise, we are doing our best professionally to serve patients and to heal them and to improve their health status. But in the meantime, there are at times mistakes could happen, and patients could be injured or be subject to death. And we have to admit that. And by admitting that, and by looking to the solutions, the options to solve these problems, I can say that in that way we can be best physicians.
Yeah. That's true. That's correct. Actually, in the introduction to your book, you say the reason why you wrote this book is because of the incident that surfaced in your hospital, where one of your doctors made a mistake and refused to admit, and it took its own course. The case took its own course, right? Can you tell a little bit about that?
Well, the incident happened in operation theater, and there was a team of around 5 to 6 medical professionals. We are working together to deal with a problem of the patient. And once we started the operation, some thing wrong happened, and the patient succumbed on the table. So after the incident, we tried to investigate what has happened, and I found out that one of the health professionals did something outside his scope and outside the consent that the patient has assigned. So after that, we did. Actually, I was responsible for that specific job in charge, and I wrote an incident report and finally did administrative action against that person. And the person was removed from that specific position. But unfortunately, I was the one who was legally responsible for the whole process, and I was imprisoned, and also I was having this medical, courts process which lasted for around 9 months. So finally, I was released.
You're cleared now.
I'm clear, but still the guy ran away with his mistakes, you know.
Yeah. How often does this happen, you think?
Well, there is no study actually which is made in our country, and there's no data. But if you take the data which is released by WHO last year in 2019, and around, for example, developing and underdeveloped countries, around 134 million incidents happen in hospitals.
Every year?
Every year. And around more than 2.5 million people die every year in underdeveloped and developed countries. And 4 in 10 patients who are attending outpatient and outpatient and ambulatory services sustain some kind of injuries. And it's better relatively in developed countries, but in underdeveloped countries like ours, you know, the problem is very serious. You know, if that's the data which is released by WHO, but if you make our own research and collect data, and then the results could be even surprising for us.
What do you think is the reason? Is it pure and simple negligence that at the end of the day would end up being criminal negligence, or the result of an ill-trained professional?
Yeah, it's a combination of many factors. For example, again from the WHO report, around 80% of these events, these adverse events, are simply preventable, you know, by taking just simple actions. 80%. So imagine out of more than 2.5 million days, 80% can be prevented with very simple measures, you know. For example, by providing checklists, and by fixing simple instruments, by just increasing the capacity of the staffs without any exaggerated resources, you know. 80%, if you completely prevent the 80%, the remaining 20%, it might be difficult to eradicate that 20%, but we can at least decrease to the minimum accepted level. For instance, if I do 100 operations per year, and if the complication rate is 5%, and the same kind of procedure, the complication rate which is registered in scientific papers is 1%, that means there is a discrepancy of 4%. Yeah, so I have to reduce my 5% complication rate to 1%. 1% by just doing some little fixes. You know, it can be with training of professionals, or it can be by providing just basic resources, and by doing checklists, as I said, and by increasing the capacity of the staffs, and by collaborating with patients in society and the public at large. You know, by doing all these things, and especially by providing basic informations on this issue, we can decrease the medical complication rate to the minimally acceptable level. So 80% if you eradicate 80%, and 20% if you decrease to the minimally acceptable level, that will bring a very significant result.
But it's interesting that these are the issues that complicate the situations when you're handling patients. I mean, these are pretty simple, pretty straightforward instructions, like keeping a checklist. You know, go by the book. Why is medical doctors not following those instructions? I mean, that's the ABC.
That's $1 million question, you know.
Is that the ABC?
It's the ABC, but we always forget to follow this ABC rule. That's a problem, you know. So we have to keep on pressing, you know, all medical professionals, public, and all the stakeholders to respect the ABCs of the profession.
So, in your job, in your line of business, there's a patient here, there's a medical doctor here, and there is that interaction that goes, you know, that conversation between the two. So how often do we have those steady conversations between the two?
Patient-doctor relationship is the basis for medical practice, you know. The patient-doctor relationship has to be very nice. And if the relationship is very good, then you can collect data from the patient, which is very important. Then all the treatment plans are established and maintained if there is a good relationship between the doctor and the patient. And finally, information will be communicated back to the patient if there is a good relation between patient and doctor. Okay? If patient doesn't like the doctor, he will not provide his information, you know, because it's confidential information. The patient will tell us his private information. So if he cannot trust or if she cannot trust the doctor, then they will not provide. If I don't respect and if I don't take care of the patient very well, then the patient will be anxious and he will not communicate the information properly. You know, so this communication is very important.
But that dynamic, that communication is missing in Ethiopia, in the Ethiopian situation. Is that a correct assessment, you think?
Yeah, it's missing. It's one of the key part which is missing. You know, if there is a good doctor-patient relationship, the whole problem will be solved there. You know, there are many factors which interferes on this relationship: organizational factors, social factors, economic factors. We can list many. But at least professionally, we can make that relationship strong. We can make our patients trust us, and we can have compassionate. If you are compassionate and respectful, patient will tell us their private health information, so that we can use that information to establish a therapeutic relationship, maintain that relationship, and also communicate back to the patient. And it's important because patients will have satisfaction on our service, and also it will decrease also health professional burnout and turnover, you know. Otherwise, if there is no good relationship...
Because that's a very stressful situation.
Yeah, it's a stressful situation, and will not be that effective on our professional capability. So, patient-doctor relationship is very key, and one of the area where we have to work, you know, efficiently and effectively to deal with this malpractice and so on, is to strengthen patient-doctor relationship.
Is that even possible? I think that's quite remote, considering the number of doctors that we have in this country.
Yeah, maybe the coverage will be small, you know.
And far in between too, yeah.
Yeah, but as long as you meet a patient, you know, I'm a doctor, and as long as I meet a patient, I should have that stronger relationship with that patient, whether the number is small or too little, it doesn't matter. But as long as I meet a patient, you know, I should establish that strong relationship between us. Yeah.
So this is much more pronounced in public hospitals. Is that correct?
Yeah.
Not in private practice.
It's the same.
It's all the same thing.
There's not much difference.
The word is what is it? Doctors in private practice tend to be more courteous, more friendly, and attending to the needs of the patients than the same doctors in public hospitals.
Yeah, but there is no subject. There is no object.
Do you have any study on this? No.
No, I don't have. But there is no. I cannot explain that. Maybe there are some other factors which drives doctors to behave like that. But as long as, since we are talking about a professional has to be compassionate and competent and also autonomous, whether he or she is practicing in private or in public places.
Do you do private practice?
I used to do, but now since I started writing this book, I've
exclusively in the public hospital.
Yeah, only in public hospital. Since also I'm attending evening school, so I was a little busy.
So it means you're also training to be a lawyer.
Yeah.
Why do you want to do that?
Because I wanted to write this book around 5 years ago. So finally I found out that I should have some legal background. So because it's a medical legal issue, most of medical legal books that are written in, for example, in Europe or US, are by medical professionals. So maybe this is the first book which combines both medical and legal issues together. So otherwise, one can write as a medical doctor. One can write such kind of book by mainly discussing the ethical part. But I wanted to combine both the ethical, the medical, and the legal part. So because of that, I decided to join law school, and now I'm a student.
So speaking of the legal side to the story, you medical doctors are torn between the law and the ethical considerations. How are you affected by that?
Well, as a medical professional...
Say, for example, talking about abortion.
Yeah, as a medical professional, we are more close to ethics, Most of our professional practices are based on ethical codes and ethical standards. But at the same time, there is also law, We are not aware of the legal aspect, but more on the ethical aspect. So some of the things that we do in our practice could be ethically sound, but sometimes it could be illegal, So we are caught in between. If you are facing court, for instance, we are only facing the legal aspect. But one of the recommendations in my book is whenever some medical practice is dealt in court, also the ethical aspect also has to be considered, so that the profession will not be excluded, Otherwise, if we only think in terms of legal aspects, so we'll forget also the ethical aspect of the profession. But as a professional, when we practice, we have to take both together, and we have to balance the acts or what we do in terms of law and the ethics. You mentioned abortion, okay. Abortion, ethically, if you start from Hippocrates, one of the Hippocrates principles does not allow medical professionals to perform abortion and perform like euthanasia and so on. But over time, because of the increase in demand of some practices, and so the modernization of medical practice and the demand to perform some procedures, there is a change in these oaths, the Hippocrates basic ethical principles. So they have revised and modernized this ethical principle, and now most of associations and health professionals in many countries have considered like to do abortion in some, like in some countries they do euthanasia, so it's not ethical. But
have you found yourself in those situations?
yeah, you find yourself in such situations, and for example, if when it comes to abortion, it's you are obliged by law to perform the procedure. So even though it's not sound ethically,
Because a part of you says no, that's wrong.
yeah, some people can say that it's wrong to do it, and it's unethical. But when it comes to law, you have to do the procedure. So there is a conflict sometimes, but and there has to be a way to solve and to find a solution for such kind of dilemmas. Yeah.
How about euthanasia? You just mentioned it. I mean, these are people with terminally ill people trying to make a safe exit out of this world.
Yeah, euthanasia
Have you
also.
encountered that? Have you ever encountered people who seek your assistance on that?
Yeah, people, especially terminally ill people, may seek termination, peaceful termination of their life, but legally, that's not possible. It's illegal. As
I know you have discussed it in your book too.
yeah, as a health professional, you have to help patients. You have to keep patients safe. Otherwise, it will be a crime. But with time, when the medical, when the situation or the situation, the life situation, the economical, political, and social conditions improves, people will ask, more their right, and such topics will come into the picture.
Do you think that this is not the time to discuss those issues in the Ethiopian medical sphere?
Yeah, because there are a lot of rights which first should be respected,
But do you, as medical professionals, talk about this issue amongst yourselves?
Not officially, because
No, informally.
Informally we talk. Okay, for example, we encounter patients who are terminally ill, very suffering a lot, and there are no drugs, for instance, which could help in relieving their distress. There are shortage of drugs and so on. So the health facility cannot take care of such kind of people very well. So in such case, you put this also as an option, for in the future maybe.
It's very interesting. You're also a musician. Is that correct?
Yeah.
You have one album released and several singles, I guess.
Yeah.
Why music? Because it is somehow therapeutic or something?
Yeah, music is my hobby. I used to play since my childhood, and but I'm a hobby musician, and after my arrest and during that court process, I was too much connected with the music, and I found out that music relieves stress, and also it builds personal psychology up. I use music to build my psychology up and to relieve my stress. And then I read a lot about the connection between music and health, and I found out that music is one of the complementary and alternative medical option, especially in the Western countries. And they are integrating music with the modern medicine, so that it can be used now frequently and together with other medical modern medicine at hospital setting, home setting, and so on. So, and actually, music at the university level is given undergraduate, postgraduate program since 1948 in US, and nowadays there are professors of music therapy and so on, and music is being used a lot in a medical setting, and there are music departments, music therapy departments like other departments, surgery or ophthalmology or internal medicine departments in each hospitals in the Western continent. So music is being used widely, and it has no side effect. So if you use as a complementary and alternative medicine alongside with modern healthcare, then it will be really useful. Yeah.
Medicine, music, ultimately also the law that you're training in, and a book. That's a very interesting combination. How well received is your book? Although it's too early probably to say.
Yeah.
But how well received is it? I mean, I guess it could be a book that everybody needs to have.
Yeah.
Not only medical professionals, but also patients and people who are interested to know more about what goes on in the profession. So how well received is it?
Now, so far the book is well received by the medical community, and also legal law students and lawyers also are revising the book, and also other professionals are reading and revising the book, and hopefully I will get some feedback. But the medical community are very happy to have this book at this time. Yeah.
It was really a pleasure having you on my show. Thank you very much indeed, Dr. Melkamu.
Okay, thank you very much once again for giving me the chance.